Hi, my name is Cicona. I'm a family nurse practitioner student at Auburn. I'm going to be demonstrating a head-to-toe physical assessment. To start, we're going to go ahead and show you the room. And I'm also going to show you my ears. Alright, so we'll go ahead and get started. A few notes before I start my assessment. I will be checking his skin, hair, and nails throughout the assessment when appropriate. I will also be doing a neurological assessment within the other body systems, as well as doing a unilateral assessment versus bilateral for the sake of cutting time. I would also normally have my patient undressed and exposed when appropriate, but for the sake of modesty, we're going to keep his clothes on. I have washed my hands, and we can go ahead and get started. So this is my husband, Kevin. He's going to be my patient today. I grabbed some vitals before we got started. He is normotensive, afebrile, his pulse is 82, respirations are about 16. And we did grab his BMI as well. That was 29 on the BMI chart. That indicates overweight, but on inspection, he appears to be well nourished, well developed, of average stature. He is alert and oriented. He is following commands appropriately. He seems to be sitting upright in a comfortable position, does not appear to be in any distress. I don't smell any odors coming from his body or his mouth, and just overall appears well groomed and appears to be in a good mood, and his mood does match his affect. So I'm gonna take a look overall at his skin. He is pink and well perfused. I don't see any rashes, any discolorations. I don't see any abnormal moles. They all seem to have regular borders and consistent color. There's no scaling or bleeding or any changes recently to any moles. His hair distribution appears even and well filled in. His hair doesn't look super oily or really dry. Let me take a look at your nails. So his nails, cap refill is a couple seconds here, but they appear to be nice and nice, cared for. I don't see any ridges or splintering. The cuticles are pushed back and nice and clean. Let's take a look, do your window test like this. There we go, and he doesn't have any clubbing. Next, we'll move on to the head. He appears normal cephalic. Gonna touch your hair and touch your scalp. I don't feel any masses or any dimpling or bulges. Go ahead and smile for me. Frown. Squint your eyes. Puff out your cheeks. Awesome. So cranial nerve 7 is intact. Next, I'm going to take a look at your sinuses, and I don't see any edema of the sinuses, but I'm going to feel for it. Does anything hurt?
No.
And then percuss. Any pain?
No.
Okay, so no pain and tenderness on percussion and palpation. Next, we will move on to, I'm going to feel your TMJ. So I want you to open and close your mouth. And then I want you to grit your teeth real tight. All right, so masseter muscle is nice and reactive to that. So cranial nerve 5 is intact, as well as no TMJ, no popping or anything like that with the TMJ, so that's good. Next, we will move on to your eyes. So eyebrows and lashes are evenly distributed. I don't see any lesions or infestations anywhere actually on the head or anywhere in his hair. The eyelids are nice and pink, consistent with the rest of his face. There's no lesions there. I'm gonna touch your inner eyes. So lacrimal apparatus, there's no discharge there, there's no redness. The conjunctiva are nice and pink, eyeballs nice, moist and glossy, and I don't see any scratches or opacities on the cornea. Next, we already did a vision exam on him using my handheld Snellen chart. With corrective lenses, he's at 20/20, which is as low as this chart goes. Basically, I would have him occlude one eye, then the other, and he would read the lowest line letters he could, and then I would also check both eyes open. So this chart is held at 6 feet to be accurate to read at 20/20. So that was good. Next, we're gonna do the confrontation test. I want you to cover one eye. Okay, and I want you to tell me, look straight at me and tell me how many fingers you see.
1, 2, 2, 1.
All right, great. Next, look straight at me. And I'm just gonna shine a light. So the light reflex test was normal. The light reflex was symmetrical in both eyes, so there's no deviation there. Next, I want you to follow my fingers. Hold your head still, just follow my fingers with your eyes. Okay, so he does follow my finger in an H pattern, 6 fields of gaze, so cranial nerves 3, 4, and 6 are intact. Next, I want you to look behind me and then look at me. All right, and then keep looking straight at me. So the pupils do constrict nice and briskly, equally to direct light and consensual. And then look at me and then look at my finger. All right, so the irises constrict appropriately. Next, we're gonna do the exam of the inner eye. Okay, so look straight ahead at me. Okay, so I can see a red light reflex. It's a normal finding. The back of the eye is nice and a deep red. I didn't see any tortuous veins or any hemorrhages back there. The optic disc is nice and round and well defined. The macula and the fossa centralis were centrally located, so overall a normal eye exam. Next, we're going to move to the ears. So we will check his hearing with the crude test called the whisper test. I'm going to occlude one ear and I'm going to whisper something behind you and I want you to repeat it back.
Apple.
So cranial nerve 3 is intact. Next, we're going to demonstrate a Weber test. I'm going to strike the fork, put it on your forehead, and you let me know if you hear it in one ear or the other or both.
Both ears.
Thank you. And then kind of the same idea, I'm going to put it behind on your bone back here and then next to your ear, and let me know when you no longer hear it.
No longer here.
Okay.
No longer here.
All right. So he does not have any conductive hearing loss or any lateralization with the Weber test. So air conduction was longer than bone conduction, which is a normal finding. Next, I'm gonna take a look at the outside of your ear on inspection. The ears are equally positioned on his head. I don't see any masses or bulging, any discharge coming out. I'm gonna feel for it. Let me know if anything hurts. So non-tender penile auricle. Next, I'm gonna take a look inside. All right, So I am able to visualize the tympanic membrane. Um, it is pearly gray. I can orient myself because my light reflex was at 7 o'clock in his left ear. I was also able to visualize the umbo, so I kind of knew where I was, but I didn't see any air bubbles or fluid lines. He had a small amount of sticky yellow cerumen, which is a normal finding, but there was no infection. Next, we're gonna move on to the nose. On inspection, it is centrally located. I'm gonna feel for any tenderness. There's no tenderness of the bone or cartilage. Put your chin up for me. So I can, the nasal mucosa is nice and moist. The turbinates are nice and red. I didn't see any prominent blood vessels or any polyps. And his septum is nice and midline. Next, go ahead and occlude one nary and inhale. So he has a patent nary. Close your eyes. Tell me what you smell.
Coffee.
So cranial nerve 1 is intact. Next, we'll move on to the mouth. On inspection of his mouth and lips, so he appears to be symmetrical bilaterally. I don't see any drooping. I don't see any lesions or crusting, anything like that. Open up real wide for me. Say ah. Okay, lift up your tongue for me. Perfect. And then stick out your tongue and move it side to side. Okay. Great. So his buccal mucosa was nice and pink and moist. His gums appear healthy and they're pink and they're tight against the margins of the teeth. The teeth are well cared for and clean. There's a slight malocclusion of the lower teeth. His uvula did move midline on phonation. His tonsils were about a +1, nice and pink. I didn't see any tonsil stones or any ulcerations anywhere in the mouth, actually. The nasopharynx is nice and pink and moist. His heart and soft palate were appropriate, with the heart palate having some normal rugae, and that did move on phonation as well. He had no deviation of his tongue. So cranial nerve 12 is intact, as well as 9 and 10. I'm now going to gag him to find out. Number 9, I know he can drink and I know he has a gag, and he can swallow appropriately. I didn't see any leukoplakia or any abnormalities on the tongue. Underneath the tongue, it was consistent with the rest of his mouth. I didn't see any discharge or swelling of his salivary glands. Those were all normal findings for me. We'll move on to the neck. His neck is symmetrical. I don't see any bulges or masses. I'm gonna touch your trachea. Trachea is firm but movable. Next, I'm gonna check for your thyroid. So I'm gonna get behind you. So no masses or nodules on the thyroid. I'm gonna also check your lymph nodes, starting with the preauricular, posterior auricular, occipital, parietal, tonsillar, submandibular, submental, anterior cervical, posterior cervical. Shrug your shoulders a little bit. Supraclavicular. And while I'm here, I'm gonna check the epitrochlear as well, and I'm deferring any lower extremity lymph nodes at this time. So go ahead and shrug your shoulders against me, and then turn your head. Okay. And then cranial nerve is 11 is intact. Next, we would do a breast exam. I am just going to talk about it again for the sake of modesty. I'm not going to perform one today. So with the breast exam, I would have my patient undressed to expose their breasts. I would have them in normal position. Then I would have them raise their hands up and then put their hands on their hips and squeeze real tight. I am looking for any changes in breast tissue. I am looking for any dimpling, any abnormal movement of one breast versus the other. Any skin changes at all, especially any dimpling or pulling of the nipple, any nipple discharge, any lumps that might pop up that are visible. Then I would have my patient lie down and put one hand behind the head, and that's the breast that I would examine. On palpation, I prefer to do a circular motion, starting at the outer and moving inward towards the nipple, again checking for any discharge from the nipple, checking skin temperature as well as any texture changes, being mindful to check my axillary lymph nodes as well as the tailspins here in the outer edge of that breast tissue. Meanwhile, as I'm doing it, I would talk my patient through what I'm doing and talk to them about self-breast exams, appropriate technique, being mindful to be systematic, as well as talking about timing and when is the best time for them so they stay consistent. We will go ahead and move on to the chest and the thorax. So on inspection, anterior and posterior thorax, he appears to be breathing nice and comfortably. I don't notice any retractions or accessory muscle use, no pursed lip breathing. He's sitting nice and upright. He's not tripoded. AP ratio is about 2:1, which is a normal finding. Posteriorly, his spine is midline, and I don't see any bulges or retractions of the intercostal spaces. Next, I'm going to go ahead and percuss. For the sake of time, I am not going to percuss both the anterior and the posterior chest, but I will demonstrate percussion on the posterior chest over here. So he is nice and resident on the back of the chest, which is a normal finding. And anytime I'm doing an assessment on the chest, I would also be mindful of the lateral sides and remembering that the right chest does have 3 lobes. Next, I'm going to check for expansion. So I've got my hands on your 10th rib. Go ahead and inhale for me. So he has symmetrical expansion with no lag. Next, I'm going to check for tactile ephemetus. So anytime I put my hands on your back, say 99.
99, 99, 99, 99.
Equal. It was symmetrical bilaterally. Next, I am going to percuss the CV for tenderness, so I'm gonna strike your back. And again, I'm just doing one side and he's non-tender. Next, I'm gonna go ahead and listen. And again, for the sake of time, I'm just going to assess the posterior chest. So take a deep breath anytime you feel my stethoscope. So lung sounds were clear bilaterally and they were equal on both sides. I didn't hear any adventitious sounds or any wheezing, rales, anything like that. So that sounded good. Next, we're gonna do the cardiac assessment. A couple notes about the cardiac assessment. Normally, when doing a comprehensive heart exam, I would listen with both my diaphragm and my bell, and I would listen with the patient sitting upright, leaning slightly forward to bring the apex of the heart closer to the chest. I would also listen supine and left lateral, as those things will accentuate certain signs or certain sounds. But again, for the sake of time, I'm only going to do it one time. I have the apical, pulmonic, Herb's point, tympanic, and mitral. So I was able to hear and identify S1 and S2 in all the locations. I was able to identify the PMI and also on palpation. I don't see or palpate any heaves, throws. He didn't have any splitting of his heart sounds, and there was no extra heart sounds or any advantageous sounds. So next we're gonna move on to the abdominal assessment, and I'll have you lie down. So while I have him lying down, I'm actually also gonna take a look at the peripheral vascular system. I don't see any abnormal vascular patterns. I don't see any edema, especially in the lower legs, but really anywhere. I'm not concerned for any venous stasis or any arterial insufficiency, as he is well perfused and his color is normal and temperature. All right. I'm gonna also check your pulses while you're down here. So the carotid, I would check one side at a time. Radial, popliteal, posttibial, and pedal. And again, I would compare both sides, and he's got about +2 pulses, which is normal. I could also check for JVD for his patient population. I don't have indication to check JVD or listen for carotid bruits. So I have you down here. We'll go ahead and take a look at your belly. So on inspection, stomach is slightly rounded. Go ahead and put your hands to your sides. Thank you. The umbilicus is midline. I don't see any lesions or scarring. I don't see any striae or rashes. He doesn't have a hernia. Next, I'm going to go ahead and take a listen. So he's got normal active bowel sounds in all 4 quadrants, and I didn't hear any bruits or anything on his aorta or his iliac arteries. Next, I'm gonna move on to percussion. So to percuss, I'm actually gonna elicit the help of my little hammer. Typically, I could percuss the liver, and I do understand that's not a very specific type of measurement for liver size, and I am not able to percuss the spleen, which is a normal finding. I am getting a bunch of resonance over the entirety of the abdomen. So next we're gonna move to light palpation. Let me know if anything hurts. Okay, and next we'll move to deep palpation. Again, let me know if anything hurts. So I don't feel any masses or growths. There's no hepatosplenomegaly. I'm not able to palpate either, which is fine. And the kidneys are non-palpable, which is normal for an adult. Next, we will go ahead and assess your musculoskeletal system. So if you'll stand up for me. These two, the musculoskeletal and neuro, I will kind of do at the same time. So I want you to walk halfway across the room for me. Okay, and then walk back towards me on your heels and your tippy toes. And one foot in front of the other. All right, thank you. Next, I just kind of want you to follow my exercises. So lift your head up and down, and side to side, ear to shoulder. Great. Arms up and back, and cross one arm over, and then back. Okay, and then hold your arms like this. And move them out and in. Okay, put your arms out again for me. Try to pull up against resistance and down. Okay, great. Next, your wrists, go up and down with your wrists. Okay, and then grasp your thumb. Okay, and then grasp my fingers. Okay, great. Spread out your fingers. And then put them together, and then spread them out against me. Perfect. So he has normal muscle development. I don't see any edema in his joints. He's got 5 out of 5 strength, and he's got full range of motion of his upper body. Next, we're gonna move on to the lower part of your body. While you're standing, I'm gonna have you touch your toes. Okay, and then lean back, and then twist, and then go side to side. Okay, great. And then go ahead and lie down again for me. All right. Put your knee to your chest. Okay. Put your legs straight and then raise up. Okay. Put it down. Just one at a time. And then raise against me. Okay. Great. And push the gas pedal. And then back. I'm gonna hold your foot and then move it side to side. Okay. Great. And then try to open up your leg against resistance and then back. Okay, great. So he appears to have, again, normal muscle development, no edema or swelling anywhere, no joint stiffness or redness. So again, 5 out of 5 strength of his spine and lower extremities, as well as full range of motion of those things. And next, we're gonna move on with the rest of the neurological exam. Go ahead and sit up for me. All right, do you remember what we had for dinner yesterday?
Sausage and peppers.
What'd you get for Christmas?
A book.
Okay, so memories intact, remote and recent. And I want you to close your eyes and tell me when you feel sharp or when you feel soft. I can do this anywhere on the body. I'm just gonna do his hand or his
Sharp. Soft.
Okay, great. Next, I kind of already assessed that he is alert and oriented, memories intact, coordination. Let's check coordination actually. So I want you to patch your legs back and forth as fast as you can. All right, coordination is intact. Next, I'm going to check your reflexes. So starting with the bicep. Okay, and then your tricep. Go ahead and get real loose for me and relax. Relax up here. Let me bear the weight. All right. Next, the knee reflex. Can you relax for me? Or cross your legs. You can cross your legs. Okay, and then the Achilles. And then I forgot one more. We're gonna do one more up here. The brachioradialis. All right, so that concludes my head to toe, and thank you for watching.